Hello friends and patients, Dr. Berry back again to talk to you about a very important subject, type 2 diabetes. Now there's some disagreement in the medical community about whether type 2 diabetes is a disease of diet or a disease of genetics or a disease of lifestyle, and also is it curable or is it not curable? And so I want to talk about this for a few minutes today and give you some insight into the things I've discovered over the last decade when I've been doing this on a daily basis. Type 2 diabetes is a devastating condition. People who suffer from it, you may have a family member who's lost a leg, who's on dialysis, who is blind, who has lost toes. I mean, it can really destroy your life. It is a huge risk factor for heart attack and stroke and dementia. It's something that you never want to come close to having, yet as America and as the Western world gets more and more overweight, type 2 diabetes becomes very, very common. In the past, when I was first training in medical school, it was almost unheard of for a child to have type 2 diabetes. It was called adult onset diabetes back then because no children had it. Now it's very common, much more common than it should be, for a child to have type 2 diabetes, and that the medical community should be ashamed of itself that there is a such thing as juvenile type 2 diabetes. That shouldn't exist. So let's talk about this, and let's talk about whether we can cure this or not. We can definitely make it better, but I think we can cure it. So first of all, let's talk about the difference between type 2 and type 1 diabetes very quickly. Your pancreas makes insulin, and if your pancreas stops making insulin for any of a variety of reasons, then you have type 1 diabetes. You have to have insulin or you'll die. So type 1 diabetics are a completely different topic. Really, type 2 diabetes probably shouldn't even be called diabetes. It should be called something else, because insulin is not the solution for type 2 diabetes as it is for type 1 diabetes. Type 2 diabetes is diagnosed in someone who previously had normal blood sugars and normal insulin levels and normal hemoglobin A1C levels, and who now have elevated levels. This is a terrible thing. If your doctor said, oh, your hemoglobin A1C is elevated a little bit, I want you to do this and this, and then we'll check it again in 6 months. I don't want you to think, oh, well, my A1C is a little elevated, it's no big deal. I want you to be mortified. I want you to be terrified that your hemoglobin A1C is elevated. That should never happen. If that happens, then you're on the verge of having terrible, terrible medical consequences. So what's the definition of type 2 diabetes? So what we go by these days is called a hemoglobin A1C, and that gives me a 3-month average of what your blood sugar's been doing on a daily basis. It's not exact, but it's good enough that we can diagnose you based on that. If your hemoglobin A1C is 5.6 or below, then that's fine. I actually want it to be much lower than 5.6, but if it's 5.6 or lower, that's okay for now. If it's 5.7 to 6.4, then you're what we call pre-diabetic, borderline diabetic, insulin resistant. In the past, we kind of acted like, well, that's not terrible, you know, it could be worse. But I want you to understand today that if your hemoglobin A1C is 5.7 or above, you are at huge risk of heart attack, stroke, dementia, losing limbs, blindness, dialysis, terrible, terrible things. I want you to take that number very, very seriously. And if your doctor, if you have high blood pressure, or if you have any other risk factors for heart disease or stroke, and your doctor doesn't tell you what your hemoglobin A1C level is, I want you to ask him. Because if he didn't check it, that's a problem. You guys probably need to have a talk, and you either need to train your doctor or you need to find a new doctor. But if he says, oh, it was 5.8, and that's not too bad, we'll just keep an eye on it. No, no, no. I want you to get on the internet, start Googling, start asking other people, other doctors. My A1C is 5.9 or 6.2, and my doctor said that's not a big deal. Is that a big deal or not? It is, okay? That puts you at huge risk for all these medical things that you don't want, trust me. So if your hemoglobin A1C is 6.5 or higher, then you are a type 2 diabetic, maybe. Now, how does your doctor know that you're not suddenly a type 1 diabetic? Well, there's a couple of labs he can check. He can either check your C-peptide level or he can just check an insulin level. And based on those labs, he can tell you if you still make insulin or not. Because if you still make insulin, you're not a type 1 diabetic. You don't need insulin ever, and we'll get to that. But if you're a type 2 diabetic, insulin is never the answer for you, okay? We'll get to what the answer is, but that's not it. So if your doctor says, oh, you're a type 2 diabetic, I'm going to start you on insulin, you need to worry about that and talk about that and say, wait a minute, don't I still make insulin? And if he says, well, I don't know if you do or not, then he needs to check your C-peptide or your insulin level and know for a fact, because there are adults who become type 1 diabetics. Their pancreas just stops making insulin. And if that's you, you need to know that, because no pill in the world will fix your diabetes. Even your diet, you won't fix it if you stopped making insulin. So you have to know the answer to that. So if your doctor doesn't know whether you're making insulin or not, that's a problem. You need the answer to that question. So let's say he did check a C-peptide or an insulin level, and you're still making insulin, you've just become resistant to it. What are you going to do? Well, there's all these pills for type 2 diabetes, and he'll probably start you on one, and for a while that's fine, but I want you to consider that pill a Band-Aid until you can fix the underlying problem yourself, because type 2 diabetes is a disease of diet, okay? Slender people who eat paleo diets in other countries never have type 2 diabetes. It's exclusively, and we call it a lifestyle disease, but that's really not even true, because you can exercise, you can live on the treadmill, and if you don't change your diet, you'll never cure your type 2 diabetes. So that's the first thing I want you to understand, is the solution is your diet. You have to fix your diet, okay? Now, let's talk about that. Is it fat that's making you a type 2 diabetic? Is it protein? What is it? 90% of the time, it's starches and sugars, okay? So if you're a diabetic, it's not cute that you drink 2 or 3 Cokes a day or sodas a day. In the South, I told you we call them Cokes, but soft drinks. That's not funny. That's not a joke. You're doing permanent damage that can never be taken back. If you're drinking tea that's sweetened, if you're putting sugar in your coffee, if you're drinking fruit juices, I don't care if they're organic fruit juice. I don't care if they're no sugar added fruit juice. You are making your diabetes worse. You're literally giving yourself diabetes by drinking those things. Stop that immediately. Someone with a hemoglobin A1C of 5.7 or higher doesn't ever need to drink a calorie ever. If it's an occasional treat, that's fine, but as far as a daily basis, you don't need to drink any calories. If you're drinking calories, you're making your diabetes worse, okay? There are essential amino acids. You have to have them. Those are protein building blocks, or you'll die. You have to have them. There are essential fats, fatty acids. You have to have them or you will die. There is no such thing as an essential sugar. There is no such thing as an essential carb. There is no such thing as an essential starch. You don't ever need them in your diet, ever. Now, the big corporations can make all kinds of things out of grains and grasses and starches and sugars, so they'll pay every big association, every medical association to say, oh gosh, you need your whole wheat, you need your grains, you need your all this stuff. No, you don't need any of that, okay? Your body will actually get better and get more healthy and flourish by not eating those things, okay? So you have to understand type 2 diabetes is a disease of your diet, which means your diet caused it. That's the bad news. The good news is that you can use your diet to cure it. Yes, cure it. That's right. I firmly believe that, and more and more doctors today are believing that as well. William Davis, a very prominent cardiologist, believes you can cure type 2 diabetes. Dr. Jason Fung, a very prominent nephrologist or kidney specialist, he believes you can cure your type 2 diabetes, and I believe it too. And I want you to believe it. I want you to investigate this, and I want you to cure your type 2 diabetes and prevent yourself from ever having it to start with. Now, do you need to lose weight to cure your type 2 diabetes? Indirectly, yes. When you get off the starches and off the grains and off the grasses and off the sugars, you're naturally going to lose weight. And that's going to naturally lower your blood sugar, which is going to naturally lower the amount of insulin that you need. And that's going to make you naturally lose weight. And it may be a little slower than you want to. And if you want to see your doctor and see if he can help you hurry up the weight loss, that's acceptable. But I want you to understand the reason you're overweight, if you are, is because of your diet. Now, if your doctor has checked your thyroid labs and your other labs, and we know there's no medical reason for you to be overweight, it's your diet. And you can play reindeer games and you can pretend like you never eat anything or you only eat raw cabbage on Tuesday. I'm sorry, if you're overweight and your lab work is normal, it's your diet. I'm sorry. Okay, so by fixing your diet, you can fix your diabetes. And so we talk about this cure, and people say, well, you can't cure it. You can just get your A1C level down low enough that we can say it's controlled. But if your A1C is below 6.4, then you're not diabetic, because that's the definition of diabetes, right? So, but I want you to get your A1C down under 5.7 so that you're not even pre-diabetic anymore, and that's completely in your hands. You can do that. You can listen to this video today, you can Google a few things, you can do some research, and you can cure your type 2 diabetes. And you don't even need a doctor to help you do it. I'd prefer if you did have a doctor, because you need someone to check these labs to make sure you haven't become a type 1 diabetic. But after that, you can do it yourself. You don't need me. You don't need your doctor. You don't need anybody. You can do it yourself with enough knowledge, okay? What about the medications? Don't they cure the type 2 diabetes? All the pills for type 2 diabetes, none of them cure that condition. All they do is they keep your blood sugar lower. And more research is showing that the blood sugar being high in your blood is just a symptom of the diabetes. That's not actually the diabetes, okay? That's like if you had the flu and it would make your fever go up, right? And so if you took some Tylenol and it made your fever go down, then did you cure the flu with your Tylenol? No, I don't think so. Did you make your flu better? No, all you did was lower the temperature. You lowered your fever. That's all you did. And that's what the pills for type 2 diabetes do. They lower your blood sugar, but many doctors and a couple of huge studies have recently shown that even if you take the pills and keep your blood sugar low, you're still doing the damage behind the scenes. It doesn't lower your risk of mortality or morbidity at all by taking the pills and keeping your blood sugar down. You have to fix this condition, this disease, with your diet, okay? What about exercise? Now, exercise is great, and if you do resistance training and you build muscle, that's probably going to help you keep your blood sugar down. But is it going to cure your diabetes? Probably not. No, probably not. Exercise is great for you. It's great for your brain. It's great for your body in hundreds of ways. But exercise is never going to help you lose weight, and it's probably not going to help you cure your diabetes, okay? The number one way you're going to cure your diabetes is by fixing your diet with either a ketogenic diet to start with and then morphing into a paleo diet. Some people can keep doing ketogenic forever, but if you're eating starches and sugars and carbs, simple carbs, you're never going to cure your diabetes, okay? If you go see a nutritionist and he or she's not in the know, they may tell you, hey, you're a type 2 diabetic, you need to eat more whole grains. If your doctor or your dietitian tells you as a type 2 diabetic you need to eat more whole grains, you need to probably look elsewhere for advice, okay? So I want to leave you with a couple of books that you can read yourself. And if you read these books, you'll be smarter than the average dietitian or doctor when it comes to type 2 diabetes. Sorry, doctors and dietitians. The truth is what it is. If you don't like it, that doesn't change it, okay? The first one is called The Obesity Code by Dr. Jason Fung. He's a prominent nephrologist or kidney specialist, and he is on top of this. You read that book and you'll understand this. You'll never be tricked again. The second one is one called Keto Clarity by Jimmy Moore. He's just a guy who was obese and diabetic, and he said, you know what, I'm sick of this. I'm going to fix this. And he did so much research on his own that he has fixed his obesity, he's fixed his diabetes, and now he's helping other people do the same thing. A third book is called The Paleo Diet by Cordain. I love this book. It was one of the very first books that woke me up and got me interested in this sort of thing. I highly recommend all three of those books to help you cure your type 2 diabetes. And in the process, you're going to lose weight as well. You're going to lower your risk factors. You're going to lower your risk of heart attack, stroke, dementia, kidney failure, all of these things, okay? There's so many of my patients running around with a hemoglobin A1C of 5.789, and other doctors have told them, well, that's okay, we'll just keep it there. But then a few years later, their creatinine level starts to elevate, and they're like, well, I've got kidney failure. I don't understand what's going on. And all the doctors act like, I don't know why you have kidney failure, but just don't take this and this and this, and we'll keep watching that A1C. Guess what, people? the A1C, the insulin, the sugar, that's what's causing the kidney failure, okay? I have other patients with an elevated A1C, and they go and see the endocrinologist. He's like, well, we're just going to watch it, and you take these pills. And then a few years later, they've got fatty liver disease. And everybody's like, I don't know why you have that. I don't know. It's just, I don't know. It's a thing. So just try to, limit your saturated fat intake. And I'm going, okay, that's not what caused that, and that's not what's going to cure that. You have to fix your fatty liver. You have to fix your kidney failure by fixing your diet, okay? There's no pill that's going to do that for you. You have to eat the right things, and you have to avoid the wrong things. That's just the long and the short of it. And if you don't like that, you can just click away from this video and pretend you didn't hear it, but you've heard it, and you've been told, and you've been warned. And if you don't heed my words, you'll suffer later, okay? More and more doctors are waking up to this, that a slightly elevated A1C is not okay. Somebody with an insulin resistance, with an elevated insulin or an elevated C-peptide, that is a huge risk factor. That's not okay, all right? So get with your doctor, get with your dietitian, and ask them about these things. Make notes and take notes and say, hey, what the heck? Dr. Berry said this was not okay, that my A1C was 6.2. Is it okay or not okay? And if they get upset that you bring information that you learned on the internet, you probably need to find a new doctor. I love it when patients bring stuff that they heard or read on the internet, when they print stuff out and they bring stuff to me. That means that they care about their health. That's actually a good thing. That's not bad, doctors. If your patient brings you stuff and you get irritated by that, you maybe need to look in the mirror and refocus, because you're trying to help people. Don't you want their help in helping them? I do. I like it when patients are motivated and want to help themselves. So please turn on notifications for this video. Subscribe. I want to help as many people as I can, and I can only do that if you share this message with other people. Comment below. As always, I'll answer every question you ask me. If you want to tag somebody in this video and they have a question, I'll answer their questions as well. I love doing this. You may be able to tell that, and I want to keep doing it and help as many people as I can not have a heart attack. I want to help people not have a stroke. I want to help people not have to be on dialysis. I want to help people to never have liver failure because their liver's full of fat because somebody told them don't eat saturated fat, and then that's ridiculous. Don't listen to that advice if someone told you that. So tell me what videos you'd like to hear about next time. I'll be happy to make one. Ask me any question you have. As always, this is Dr. Berry, just doing the best I can.